it's a beautiful day at Lowenstein Chiropractic Center. I'm Dr. Tessa Lowenstein, and today we'll be talking about sleep. There are three things that our patients most often talk about when it comes to sleep. The first one is pain. Pain keeping you awake, causing insomnia, anything like that. So we'll talk about that and what we can do for you. The second thing is, what's your sleep positioning and what's your sleep hygiene? The posture that you have when you sleep is super important, and we'll talk about that too. The last thing is pillows and mattresses. Are they helping you in aiding a good night's sleep? So the first thing we'll talk about is pain. Pain keeping you awake, keeping you in that unhealthy sleep cycle, not letting you get those desperately needed hours. What we can do as a chiropractic office is set you through a series of care plans to reduce the pain that you feel in your nightly activities. Whether it's because of a twinged muscle, a rotation in your vertebra, there's so many things that can cause discomfort as you sleep, and what we can do is correct some of those areas that are causing you pain so that doesn't bother you as much anymore. As far as the glass of milk you had before bed, nothing we can do about that. Regardless, that's something we offer in our office. The second thing is sleep posture. It's so important to know that there are three really important things we look at when it comes to our sleep posture. So the third is our least impressive sleep position, and that is face down. Chiropractors do not like you to do this whatsoever. If you're face down, you have to rotate your head to one side or the other, and that creates a lot of issues when you keep doing it over and over again. Remember, and this is super important, a third of our day is spent sleeping. So we want to make sure that we're in the great position in order to make sure that whatever's getting built in isn't you sleeping on your stomach with one side or the other. The other thing that can do is hurt your low back in the long run as well, depending on the health of your mattress and your pillow. So that's our no-no. Our next one is sideline sleeping. Those are okay as long as we're doing it the right way. So if you're sleeping on your side, make sure you're varying up the positioning in the side. If you're just on one side all night and that's all you do every night, that's really not going to help you out, because if it's the right side, you'll just be laying there and that's going to build in some issues on that right side. So make sure you're switching it up. The next thing is to make sure you have something like a pillow in between your knees when you're on your side. That way your hips don't create this kind of caved in appearance and your knees start to knock together. So side sleepers, make sure you're reevaluating what you're doing, and then you'll be okay. And then the last thing is people that sleep on your back. You got it. Exactly the way we want you to go. The only thing that might be even better is this next section, which is talking about our pillows and our bed. So a lot of people actually ask whether or not we consult on mattresses and pillows, and absolutely we do. Every chiropractor should have an opinion on that mattress or pillow. If you're using something like a memory foam versus a spring, if you're having something like a pillow with a good amount of neck support, those are all things we would look at. So make sure you have good neck support, not too much, not too little, but it's really all something that would be dependent on your case in particular. So talk to your local chiropractor about the perfect mattress and pillow for you. And that is it. So if you have any additional questions, please feel free to call our office at 719-630-7032. We'll answer all your questions about your sleep habits. Take care.